Dean Lobster, Village of Potsdam. In researching community water fluoridation, there are so many aspects to consider. What are some fluorides good for? Most of us understand it's good for the teeth and reduces dental caries. My dentist friends, whom I respect, will get no argument from me when it comes to topically applied pharmaceutical grade fluoridation. Fluoridated toothpaste or calcium fluoride, a naturally occurring fluoride, being actually good for the human body. What are some silica-based fluorides such as hexafluosilicic acid and sodium fluorides not good for? Ingestion of silica fluorides has been demonstrated to negatively affect the human body in many adverse ways. Mounting credible evidence suggests that systemic intake of excessive fluoride is linked to dental and skeletal fluorosis, endocrine disruption, hypothyroidism, bone cancer, and lowered IQ in children. It is not surprising that hundreds of U.S. and Canadian cities and towns have now opted to either reject or cease fluoridating their water supplies, joining over 97% of Europe and most of the developed world in rejecting compulsory water fluoridation. Before the September 17 vote, I would ask our board to consult our Mohawk neighbors to the north and why they are opposed to fluoridation, as well as the city of Cornwall. And by the way, the city of Albany and the city of Portland does not fluoridate. Considering the ill effects, one cannot understand community water fluoridation without the notion of informed consent. And of course, I cannot go into great detail in 3 minutes, but in studying the concept of informed consent, I came across a court case from 1974. According to common law, a lack of consent is part of the definition of assault. The first New York decision considering the issue of consent in a medical context was Schlondorf v. Society of New York Hospital, when then Judge Cardozo stated, "Every human being of adult years and sound mind has a right to determine what shall be done with his own body. And a surgeon who performs an operation without his patient's consent commits an assault for which he is liable in damages." I understand community water fluoridation is not necessarily an invasive procedure, but however, no less important is the fact that medicating the general populace, feeding the public water supply without their individual informed consent with a known and identified neurotoxin could be construed as an assault on each and every one of us that does not give their informed consent. Joel Achenbach, a very pro-fluoridation author, who cites outdated research and works tirelessly to silence dissenting voices, said this: "Science tells us the truth rather than what we want the truth to be. And in science, it's not a sin to change your mind when the evidence demands it. Regarding chemical fluoridation of any type, we are now demanding the pro-fluoridation medical community should no longer be ignoring the adverse effects of silica fluorides. The mounting evidence of adverse effects is now demanding the medical community's attention, and chemical water fluoridation should cease immediately."
Thank you. Anyone else?
I wanted to just clear up a couple of things that, yes, I'm sorry, that's Dr. Johnny Johnson, pediatric dentist from Florida. Excuse me. I wanted to clear up a couple of things. One is that there is a database of all fluoridation lawsuits that have ever been done, have ever been tried in the United States, and it's called fluidlaw.org. There has never been a lawsuit against a group that has ever been won in a U.S. court that says that fluoride is a medicine, is forced medication, it is an infringement upon rights, it is infringing upon your social rights. That law that was just spoken about had nothing to do with fluoride, but yet that is a very common point that is made, that somehow, it's made against all communities I've been in, you're going to be sued for adding fluoride to the already minuscule amount that's in your water. Secondly, as a neurotoxin, fluoride is on a list of neurotoxins, like the gentleman that's the environmental engineer said, at a very high level. So is the caffeine that's in my Diet Pepsi, and so is the alcohol that's in my glass of wine when I get home. all things at high doses can be harmful for you. So fluoride, alcohol, and caffeine are in the same neurotoxic groups. At low amounts, I enjoy my diet soda, my cup of coffee. I'm not killing myself. If I offer you one, I'm not trying to kill someone else. Thank you.
Thank you. Anyone else wish to speak?
Klaus from. I live in Canton. I'm a village trustee in Canton. And Canton went through this debate some 10, 15 years ago, so I know what you guys are going through. And I know you're being swamped by both sides of the issue. And I think my comment would be, we're just not sure what the effects are on other systems of the body. And when we're not sure, we'd rather lean in the direction of not forcing it on people. So my advice would be, in Canton made a decision not to continue to fluoridate their water. And as Dean mentioned, 97% of Western Europe does not fluoridate their water. 16 countries in Europe don't fluoridate. And there's a reason for that. Those folks also were bombarded by both sides of the issue and studied it long and hard. And 97% of them decided not to. So kind of keep that in the back of your mind. And my advice would be, when we're not real sure, don't force it on people. Thank you.
Thank you.
My name's Catherine Lobsher, and I live in the village of Potsdam. I know the village administration is trying to decide what is best to do for everyone, but I don't believe that putting fluoride in our water is what's best for anyone. Whether you agree or not, there is research that shows a connection between fluoride and skeletal fluorosis, neurological problems, and underactive thyroids. I have an underactive thyroid, and all the research I have done tells me I should stay away from any fluoride. I filter my drinking water, but I cannot afford to filter my bathing water, so I'm sure that my body is soaking up all that fluoride. But let's put that aside. Your main concern is underprivileged children's teeth. I don't think putting fluoride in their water is the best choice. Putting fluoride in their water is very ambiguous. What about the child that doesn't drink water, he lives on soda? The American Dental Association recommends specific doses of fluoride for each age group up to 16 years. But right now, there's no way of knowing how much fluoride these children are getting or not getting. I suggest you quit paying to put the fluoride in the water and use that money to put the program back in the school. That way the children can get exactly what the dentists recommend when it is being recommended. Thank you.
Thank you.
Okay, I'll try to pronounce this, I always get it wrong. Hydrofluorosilicic acid, or HFSA, is a byproduct of the foreign and domestic phosphate fertilizer industry. It meets the criteria for classification as a hazardous waste: toxicity, reactivity, corrosivity. Fluoride is not approved for ingestion by the FDA. The fluoride treatment is not pharmaceutical grade and contains arsenic, a known carcinogen, well above the acceptable range of ingestion, which is 0. By fluoridating, you are adding arsenic to your water. Toxicity levels are not tested or labeled. I sent a reference for this so that you could look it up. Fluoride-treated water is associated with neurotoxic effects, including lead toxicity. Fluoride increases the toxic burden of each who consume it, especially the vulnerable, such as infants, elderly, people with certain illnesses, thyroid issues, for example. According to the International Academy of Oral Medicine and Toxicology, the potential health risks generated from exposure to these sources of fluoride are often overlooked. Additionally, Age, gender, genetic factors, nutritional status, weight, and other factors are known to influence each person's unique reaction to fluoride. For example, children's exposure to fluoride is extremely important to consider, and this issue was made evident in recent news about a study linking fluoride exposure in utero to lower IQs. As another example, fluoride was recently identified as one of 12 industrial chemicals known to cause developmental neurotoxicity in humans. Increased sources of fluoride exposure are accompanied by increased human health risks. Therefore, it has become a necessity to reduce and work toward eliminating avoidable sources of fluoride exposure, including water fluoridation, fluoride-containing dental materials, and other fluoridated products. That's a quote from the International Academy of Oral Medicine and Toxicology. There is no way to opt out of this medical intervention. Filtration is too costly, especially for those with limited income. To suggest the opt-out is not drinking our own water demonstrates a lack of empathy and understanding of human health. Water is vital. Fluoride is not. What we get from food is what we need. What we get from water is what we need. This is a real ethical issue which is being whittled down to dental caries, and it's absurd. This issue is far beyond what we can discuss in this evening. A lot has to do with poverty and diet and genetics. Fluoride affects your entire body, from your teeth, fluorosis, to your bones, skeletal fluorosis. Additionally, there is no way to apply proper dosage limits for each individual within the community. Infants are being exposed to far larger doses than is healthy or safe. This is irresponsible. You can only make the decision based on the information presented and your ability to comprehend it. We've given you a lot to think about on both sides, and it's clear we all don't know all the implications of fluoridation. There's no way that we could. The science is not up to date, and there's so much for and against. It's irresponsible to rule on this and put it in the water until we know absolutely, which we don't. And I would say the anti-fluoride side, which we're all on the same side, we've given you ample evidence showing there is a need to implement the precautionary principle. I personally have given you numerous papers, some peer-reviewed, demonstrating that there is a health and safety issue. By acknowledging that fluoridation is for the medical treatment of dental caries, you understand that any medical intervention, there needs to be informed consent for each individual treated in a civilized society. To put fluoride into every household and business, you're exposing the entire community to fluoride. The rationale being that you're treating every individual for dental caries, whether they need them or not. This is unethical. This is a room full of very bright people, and I think that we all have the best intentions, but I think we just don't know. Thank you.
Thank you. Okay.
Excuse me.
My name's Stephen Casper, 32 Chestnut Street. I support water fluoridation. I would like us to continue fluoridating our water. There's a lot of words. I'm not going to offer any more of them. I would just like to say that personally, I would like to see a referendum on this issue if it comes down to you deciding to stop fluoridating our water. I think, in fairness to all the people who can't be here, what we see here are a lot of people who are active on both sides of this issue, and frankly, I think we could go around in circles and all disagree back and forth. A vote gives everybody informed consent. No one is forced to live in the village. We've heard that Canton doesn't fluoridate their water. People can move there. But at least, right,
No, they
we can
can't.
have a vote and decide collectively and get all of the people on this issue to the polls. So that's my position. Thank you.
Thank you. Anyone else? Ladies first.
Go ahead.
Yes.
Thank you. My name is Paula Dumel. I am a resident of the town of Potsdam. I am not going to stand here and give you science on either side, because I think we've had enough of that, and we don't need to continue the polarization. I grew up on well water. I have avoided fluoride my whole life, initially not because I had any idea I needed to. I just grew up on well water in Glacier Falls. I have wonderful teeth. very strong, sturdy, healthy teeth. I grew up on a whole food diet. It is the root causes of dental cavities that we have to address, which is lifestyle habits. I have 2 children, 16 and 19, grew up on well water, whole food diets. They have beautiful teeth. I appreciate the questioning on both sides of the issue because it helps us all to learn, to grow, to do research, and that's a beautiful thing. But what we're here to is objectively evaluate the ethics of putting chemical medicine in our water supply. That's a public water supply. And as a registered nurse, I work with clients one-on-one around a lot of health issues. And I know we have a lot of health issues in our culture, our society. Cardiovascular disease that impacts all of our organs, diabetes, cancer, autoimmune conditions. And I can tell you right now, if the public health policy was to start putting chemical medication in our water to prevent all these public health issues we have, I would be standing there flaming mad, because that's not how we take care of public health issues, by medicating the masses without their consent. So I think it's our civic duty to take that out of the water. Thank you.
Thank you.
Hi there. My name is John DeLong. I'm a resident of the village of Potsdam. I've lived here for 20 years with my wife and 2 children. I live at 24 Chestnut Street. I'm in favor of continuing water fluoridation. Many people have framed this as an issue of choice, and people wanting to have the choice of whether or not to have fluoride in the water. My wife and I made a very conscious decision to live in the village of Potsdam, partially because there was going to be a municipal water supply with fluoridation. So what I'm saying is that if you take away the fluoridation, something we've been doing for, I would gather, over 50 years, you're basically going to be eliminating my choice to have fluoride in the water. And we specifically chose partially to live in the village for that reason and pay the additional taxes to have that. So if you're doing that, it's an issue of choice on the side of those who want it as well. And some of us who want fluoridation, might not have the ability to move to a community that has it. So it's the same issue on both sides. The issue of choice really affects everyone, whichever way you decide. And so in a sense, it's almost a red herring, I would say. The other thing I would say is, and this goes back to Al Rosner's point, don't change what we've been doing for the last 50 years unless there's a demonstrable reason to do so. And everything that I've seen and everything that I've heard in these hearings and everything that I've read about doesn't suggest to me that there is a demonstrable reason to make a change at this point. So without that, the principle says you keep doing what you're doing and don't make a change until there's evidence to say so, that you should make a change. 50 years of science and experience have shown us that fluoridation is safe and effective. I will once again reiterate, I know a lot of people have said it, but I think it bears repeating because we hear a lot of people citing studies and studying statistics about how many communities do or do not fluoridate. But I want to point out that the American Medical Association, the Centers for Disease Control, the EPA, the World Health Organization, the American Dental Association, all endorse water fluoridation. And that's good enough for me at this point, because that means that they believe that the science is on the side of fluoridation and that we should continue to fluoridate. The CDC has called it one of the 10 greatest health achievements of the 20th century. I don't think we should so easily jettison that without demonstrable proof that there's a problem with doing it. And so I think we should keep it. I will also add to what other people have said, which is that this decision, if we decide to stop fluoridating the water, will disproportionately affect those that are most vulnerable in the community. We've talked about children who are in poverty that may not get proper dental and medical care. And we've talked about, I'm glad that the dentist mentioned the CP folks, who sometimes have to be sedated to have dental care. Those are real consequences of making this decision. And therefore, unless we have more demonstrable proof, we should continue to do what we've been doing and keep water fluoridation. Thank you.
Thank you.
Good evening. I'm Dr. Lee Aiken. I'm an oral and maxillofacial surgeon. My practice is around the corner here, 29 Main Street. I also live in the village. My children go to school here. We moved here 8 years ago from California. I just want to talk a little bit about St. Lawrence County. Not talk about Europe, let's talk about St. Lawrence County. One of the things that really surprised me when I moved here was the amount of dental decay. principally concentrated among the poor, but also among those that have poor access to dental care, for whatever reason. And having lived and practiced only in California up to this point, I had never seen such rampant decay. Unless I was treating a patient who was, an addicted drug user. These were young patients with soft teeth that seemed to crumble. And it was clear to me that I was now living in a rural area with a large population who doesn't have access to fluoridated water supplies. San Francisco, Los Angeles, where I had previously practiced, both fluoridated. So I asked myself, is this decay the result of large people on well water? Or is this decay that I'm seeing the result of a large number of poor people? And poor people tend to have poor oral hygiene and therefore more decay. Makes you wonder a little bit. Well, you might be interested to know that I also work in the prisons, local prisons here. So I go into Governor and Upstate Correctional Facility, and I see a lot of inmates from New York City who grew up on fluoridated water. And on the whole, their teeth are stronger. Nearly all of them come from poor families. They're from poverty. And they do not have stellar oral hygiene. Some people can grow up on well water, but they have regular dental visits and they're very careful about taking care of their teeth with topical fluoride treatments. That's not this population. Their teeth are stronger in the prisons and they're keeping them longer, and it's clear there's a difference. So what I'm saying is, from my own personal experience, the average person with poor oral hygiene living in a community with fluoridated water will have less decay and benefit greatly from frequent exposure to small amounts of fluoride over time. It makes a difference. But community water fluoridation benefits everyone, right? Not just those who have poor oral hygiene. And make no mistake, the decay is widespread here. Widespread. Because many within our communities, and even right here in the village, neglect their teeth. They don't brush, they don't see the dentist, and they tend to wait until the infection develops, and then they walk into the